Body temperature, heart rate, and respiration rate all fall within a typical range for dogs. Dogs need these things to manage their bodily functions, but they can also change if there is an issue. Any dog owner would benefit from knowing what normal readings for a dog are and what they could signify if they aren't. How do you measure a dog's body temperature? The temperature of a dog's body tells us whether or not the dog is hot or cold. A thermometer is used to measure this, and a rectal temperature is the most often used method for determining a dog's temperature. 1. Celsius or Fahrenheit are used to measure the temperature. Body temperatures of a dog. Hypothermic/low. Below 100 F. Normal 100.5 102.5 F. Hyperthermic/high/fever. Over 103 F. Rectal temperature range in a dog in degrees Fahrenheit. An unhealthy dog's temperature concerns. In a healthy dog, the temperature of the body is meticulously controlled. Cold exposure, such as spending too much time outside on a bitterly cold day, can cause a dog's temperature to drop dangerously low. Heart illness, blood loss, or shock following an injury can all induce a low body temperature, as can poor circulation. It is possible for a dog with a low temperature to suffer tissue damage and even death as a result of insufficient blood supply to all regions of the body. When a dog's temperature rises dangerously, it may be a sign of heat stroke, which is caused by prolonged exposure to a hot environment. In some situations, a dog's temperature may rise due to an infection, a seizure, or if the dog is agitated or stressed. Internal organ damage, bleeding in the gastrointestinal tract, convulsions, and even death can occur if the body becomes very hot, hyperthermic. If a dog's body temperature is abnormal, it may be drowsy and unresponsive. The dog may shiver if the temperature is too low, but this isn't always the case. Your dog's paws may be chilly to the touch, which could indicate that it has a low temperature. A dog may pant if it is overheated, although this is not always the case. You should get your dog checked out by a professional immediately if you see any of these symptoms. 2. How does a dog's heart rate compare to that of a human? When the heart rate of a dog is monitored at a location other than the heart, it may also be referred to as the pulse. It measures the number of times a dog's heart beats each minute and is referred to as beats per minute or BPM. It is possible for a dog owner to feel their dog's heartbeat by placing a hand over their dog's heart. The ideal place to listen for a heartbeat is right beyond the left armpit along the chest wall, which is where the heart is located. A lean dog may clearly feel the beats. The heart rate is calculated by counting each heartbeat over a 60-second period. Beats are counted for 15 seconds and then multiplied by 4 in order to get the same reading and reduce the time it takes to get this information. 2. Alternatively, a dog's artery can be palpated by a veterinarian or other veterinary specialist with a stethoscope to gain this information. Heart rates of a dog. Large breed, small breed. Bradycardic/. Low below 60 bpm, below 80 bpm. Normal 60 to 90 bpm, 90 to 120 bpm. Tachycardic/high over 100 bpm. Over 140 bpm. Percentage change in dogs' resting heart rates. The heart rates of smaller dogs are often higher than those of larger canines. When dogs are anxious, their heart rates can briefly rise. When a dog has an abnormally high or low heart rate. If a dog's heart beats too slowly, the entire body does not receive enough blood. There is a risk of organ failure, which can lead to death. A low heart rate can be caused by a variety of factors, including a heart or blood pressure problem, an extreme cold condition, hormonal issues, or even medicines and poisons. Too rapid a heartbeat might reduce blood flow because the chambers do not have enough time to fill and pump blood all the way through the arteries between contractions. Fear or excitement, pain, fundamental cardiac problems, blood loss, dehydration, hormone disorders, high temperature, or drugs/toxins can all raise one's heart rate. Respiratory rate in a dog. What is it? It is possible to measure a dog's respiratory rate by counting how many times he inhales and exhales in a minute, BPM. 1 breath is defined as an inhalation and an exhalation. Breathing is the process of bringing in oxygen and expelling carbon dioxide from the body. A dog's nose is the most common place for this, although they can also do it through their lips when they are panting. Measuring a dog's respiratory rate while they are resting or asleep is the most accurate method because there is no movement, panting, or other variables that could affect the rate. Respiratory rates of a dog. Bradypneic/low below 8 bpm. Normal 10 to 30 bpm. Tachypneic/high above 30 bpm. Dog's breaths per minute, BPM, while they're sleeping. There are several reasons why a dog's respiration may not fall within this usual range while it is awake. Canine problems associated with an unusual respiratory rate. When a dog's respiratory rate is either too slow or too high, all of the body's tissues are not properly oxygenated. The organs and tissues may be permanently damaged, the dog may get weak and collapse, and it may even be deadly if the body does not receive enough oxygen. Fear, excitement, severe activity, lung disease, pneumonia, for example, drugs/toxins, hormone irregularities, elevated or low temperature, and many more are all possible causes of abnormal respiratory rate. Excitation, fright, high temperatures, and exercise can all cause dogs to pant, but if it persists for a lengthy amount of time or your dog appears disturbed, you should take him to the doctor.